Hey, everyone, it's Deanne here, and today is video number 8 of the Ultimate Digestion Series. We are talking about the large intestine today, also known as the colon. This is the final part of that digestive system. It's responsible for absorbing water and electrolytes and also forming stool from waste. It is approximately 5 to 6 feet long and it wraps around the abdomen in an upside down U shape. So there are different sections to the colon. So you may have heard of some of these words. So I just want to go over this with you. Remember last week we talked about the ileocecal valve. So the cecum is the very first part of the large intestine. And if you look at the photo, you'll see this little tail that hangs off. That is actually the appendix. Then the large intestine moves upward on the right side of the body. So from basically kind of your right hip bone up towards where your ribs stop. And this is where fermentation starts to happen. There's absorption of water and electrolytes and nutrients. Then the large intestine moves straight across from right to left, and this is above your belly button, just underneath your ribs. This is called the transverse colon. Again, more processing done here. Then it moves down the left side of the body from the ribs down to around the left hip bone. And then it moves inward towards the rectum and the anus. That little curve after the descending colon is called the sigmoid colon. And that's really where the poop is stored before it moves down into the rectum. So let's look at the roles of the colon. This is where water is absorbed from digested food to really make up the consistency of the stool. This is very, very important for the stool and very, very important for your hydration. It absorbs important electrolytes, specifically sodium, potassium chloride, and this helps maintain nerve transmission, muscle contraction, and just that acid-base balance in the body. There's formation of stool and then eventually the elimination of stool. And bacterial fermentation. We're going to be talking about that microflora, that good bacteria. That beneficial bacteria basically ferments specific carbohydrates and then produces short chain fatty acids. These fatty acids are food for the colon cells in the lining of the colon. Vitamin production. That good bacteria also produces vitamin K, which is necessary for blood clotting, wound healing, and bone health, and also certain B vitamins. And these are for energy, for concentration, memory, heart health, and even nerve cells. There's also immune function that's going on in the colon. Remember, we talked about the GALT several videos ago. There are also immune cells in the colon. Storage and regulation, storing the waste, and when it's ready, it will be eliminated. So now let's look a little bit deeper at microflora. You may have heard it, microbiome, gut flora, microbiota, all the same thing. It refers to the diverse community of microorganisms in the colon, and that can be bacteria, viruses, fungi, protozoa. This group of organisms digests certain fibers, complex carbohydrates too, that the stomach and the small intestine aren't able to digest. Produces vitamins, B vitamins, and K. Also supports immune health by protecting us from harmful germs. Maintains our health by keeping the digestive system balanced and preventing constipation or diarrhea. And then preventing harmful bacteria by basically crowding it out. So, not allowing it to live where it lives. So, what can go wrong in the colon? First off, movement. We can have slow movement through the colon, and that is going to cause hard, dry stool, constipation. We can have too much water, so not enough water is absorbed, or we can also just have rapid movement through the intestines into the colon, and that can cause diarrhea. We can have damage to the lining of the colon, and we can actually get ulcerations, which we'll talk about a little bit more because that's actually ulcerative colitis or Crohn's. And so this is inflammation within the intestines. We can have diverticula, which are these small pouches that form in the wall of the colon, usually in the area of the sigmoid colon. and that can cause infections and pain. We can have lots of different types of infections: viral infections, bacterial infections, yeast, and parasites. And so those things can cause diarrhea, pain, cramping, and just disrupt normal functioning. And then we can actually have growths in our colon. So we can have abnormal cells that become tumors, that become colon cancer. So let's look at some specific symptoms that you may be having because your colon isn't working well. Abdominal pain, that could be on the right side or the left side. Cramping, bloating, gas, constipation, diarrhea, a change in stool, urgency, feeling like you need to go, and then also incontinence. So now we're going to dive deeper into these issues. Let's look at dysbiosis. This is basically the imbalance of that microflora we were just talking about. So it's when harmful bacteria are basically outnumbering the beneficial bacteria. And this can cause problems in the colon. So, when we have dysbiosis, we can also have IBS. We can also have IBD, which is inflammatory bowel disease, such as ulcerative colitis or Crohn's, allergies, eczema, obesity, diabetes. So dysbiosis can actually be that root cause for many things down the line. So why does this happen? Poor diet. We have to feed those good bacteria. So if you're eating foods that aren't feeding the beneficial bacteria, then you're basically feeding the wrong kind of bacteria. As you know, sugar can really feed yeast. So if you're eating lots and lots of sugar, you're going to allow the yeast in the colon to outnumber the beneficial bacteria. Antibiotics, they actually kill the good bacteria and the bad bacteria. So they can wipe out everything and cause a lot of issues. Other medications, such as PPIs for reflux, birth control pills, nonsteroidal anti-inflammatories like Motrin, Aleve, or Advil can all cause issues. Chronic stress, toxins such as heavy metals or pesticide, not getting enough sleep, and sedentary lifestyle. Now let's look at inflammatory bowel disease. So we have Crohn's disease, which can actually be in any part of the digestive system. And you can have abdominal pain, diarrhea, weight loss, and fatigue. Or there's ulcerative colitis, which is really just in the colon and the rectum. And this can be a lot of bloody diarrhea, lots of pain. And the reasons that you can get this are basically inflammation. So you're damaging the lining of the colon. This can happen genetic predispositions. This can also be because the immune system is not working well. These are autoimmune diseases, meaning that the immune system is actually mistaking certain cells in the lining of the colon and saying that they're not supposed to be there and attacking them. Environmental triggers, microbiome issues, stress, and smoking is specifically linked to Crohn's disease. Irritable bowel syndrome. Now, this is an umbrella term for any kind of issue in the gut that the doctors can't figure out what it is. Now we actually have a designation of IBS-C for constipation or IBS-D for diarrhea. Root causes: anyone who has irritable bowel syndrome has leaky gut. The two go hand in hand. And usually that can be because of stress and anxiety that can cause leaky gut. You can have a disruption between the communication of the gut and the brain. You can have motility issues, so things aren't moving well enough through the gut, which is usually connected to the nervous system because the nerves activate that motion. Gut microbiome imbalance, trigger foods. Certain foods can actually cause leaky gut. Food poisoning can definitely cause issues because you're having problems with the normal functioning and you're wiping out certain things when you're having diarrhea move through, and there's a lot of damage and inflammation that is left. And then hormonal changes. You might realize that when it is your period, you might have specific IBS symptoms that come along every month. The diverticula, those little sacs that we were talking about. So diverticulosis is when you just have those sacs, but when they become infected or inflamed, it becomes diverticulitis. And that's when there's a lot of pain, fever, nausea, vomiting. And this can happen mainly because of improper diet, just not a healthy diet. Maybe you're not eating regularly, you are not sleeping well, you're not exercising, you may have exposure to a lot of chemicals, you definitely have stress. So, the ways we prevent and manage this are looking at those things, improving the diet, definitely decreasing that inflammation that is going on in there. Hydration, exercise, stress management, and emotional release. When we keep things in and we're not either talking to someone or letting them go in some other fashion, then that can cause problems with our gut. Colon cancer, basically, that can be genetic mutations. That can be the diet, just really bad disruptive habits over a long period of time, sedentary lifestyle, inflammatory diet. And even if you have Crohn's or ulcerative colitis, that increases your risk for getting colon cancer. So what can we do naturally to keep our colon healthy? As you remember, these are going to be very similar to all the things we've been talking about throughout the entire digestive system. Number one, intentional eating. How you eat is so important. Being relaxed, being in that parasympathetic nervous system so your food can actually digest and be absorbed and then move through the system. So remember to be intentional. It is to sit down when you eat, to be grateful for your food, to make sure you're relaxed. So maybe taking a cycle of 6 long, slow breaths in and out, looking at your food, taking small bites, really enjoying it and savoring it, and not swallowing it until it's liquid form. Eating fiber-rich foods, meaning lots and lots of veggies, fruits, beans, lentils, nuts, seeds, drinking water, staying hydrated. Regular exercise is going to help that movement through the gut. Probiotics and prebiotics, which we'll talk about in a bit. Avoiding processed foods, reducing the amount of sugar, the artificial additives, the chemicals that they're now putting in so many snack foods. Belly breathing, the best way to calm the body down, and massage, which we'll talk about. So let's look at the difference between soluble fiber and insoluble fiber. So you may not really realize the difference. And so I just want to give you an idea. But a lot of them are crossover anyway. So you don't necessarily have to say, oh, I'm going to eat some soluble fiber now, or tomorrow I'm going to be insoluble. You don't really need to think about that. But this is actually able to dissolve in water and it forms like a gel substance. And so this slows down the passage of the food through the digestive tract, which can help regulate your blood sugar. So this is really important for people who are either pre-diabetic or diabetic or just get hangry very easily. It can lower your cholesterol because it binds to cholesterol and it promotes a fullness, that satiety, so you can stop eating. And it also feeds the gut bacteria. And some of the sources are beans, lentils, apples, citrus fruits, carrots, Brussels sprouts, flax seeds. Insoluble fiber does not dissolve in water and it remains pretty much intact as it moves through the system. And this adds bulk to the stool, and that can prevent constipation. And this is nuts, seeds, green beans, peas, cauliflower, potatoes, the skin of fruits like apples and pears. So there is, some similarities between the two. Now let's look at prebiotics and probiotics. So first let's look at probiotics because we've talked a lot about microflora. That's actually what it is. It's the live or dormant beneficial bacteria that lives in the colon and supports balancing of our gut. And these include fermented foods like kimchi, sauerkraut, kombucha, really good quality yogurt, kefir. So, all of these things, okay? Prebiotics, on the other hand, are the food that feeds the bacteria. So, this is the food for the microflora. Onions, apples, bananas, garlic, dandelion greens, Jerusalem artichokes, many, many things. So now let's look at how to massage the colon. We did talk about massage a little bit earlier, but this is going to be specifically for the colon. So I recommend that you lie down and you're basically going to be massaging the way the colon sits in the body. So we talked about how it starts at the right lower quadrant around that hip, the hip bone that sticks out. It's going to go straight up to the bottom of the ribs, straight across, and then down. So if you take your hands, your fingertips, and you can either put them on top of each other or you can just use one hand, you're going to make a circular motion, a small circular motion. So if you start at your right hip, you can just move right in from your right hip and you can just make small circles. I often say 8. So 1, 2, 3, 4, 5, 6, 7, 8. And then you basically move straight upwards and do it again. And then you move upwards until you want to still be under your ribs, do it again. And then you start to move all the way across and then down, doing that same circular motion. This is just a way to look at it. You can do it sitting up. It's much easier to do it lying down. And you can just see that it's following the way that the colon actually sits in the body. So up, across, and down. So takeaways about the colon. Eat a fiber-rich diet. That means lots and lots of veggies, fruits, nuts, seeds, lentils, beans. Stay hydrated. Drink enough water because you need that water to actually form the stool so it's not dried out and it's not little rabbit pellets. Stress. Stress is turning off your digestive system. So there's going to be stressful times during the day, but knowing how to turn that stress down, knowing how to shift from the sympathetic nervous system to the parasympathetic nervous system is paramount. And we talked about that. You can do that with breathing. So just by doing your belly breathing, closing your eyes, you can actually shift yourself into that relaxed state. Regular movement, that can just be walking, super easy, taking probiotics. Now, we also said taking prebiotics, limiting processed foods, limiting sugar, getting enough sleep so the healing process can actually occur. Love and laughter. Being happy really causes a release of some wonderful hormones that keep us nice and healthy, and then limiting toxin exposure. So, if you have not watched my 20-minute video, the 3 reasons you haven't improved your gut issues yet, then you can go to getguthelp.com and you can watch that video. It just goes into a little bit more in depth about the things that maybe you've been trying to do that haven't been working. So it just gives you maybe an aha moment about, oh, this is maybe what I need to think about. And please schedule a root cause call with me. It's a 15-minute free call where you fill out a form prior so I know a little bit about you. When we get on the phone, I'm going to ask a few more questions, and then I'm going to outline what I see as your top 3 root causes of why you're having problems, and then what you can do to start improving. It's not a sales call, it's a clarity call for you. All right, I hope you've learned a lot, and I will see you soon.